Hi, everybody. I want to welcome you back for the first grand rounds of the academic year. Hope everybody had a great summer. Looking forward to an exciting grand round schedule this year. We got some great talks coming up. I'm going to start with our land acknowledgement. We'd like to acknowledge the Ramaytu Shaloni people who are the traditional custodians of this land. We pay our respects to the Ramaytu Shaloni elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We're proud to continue their tradition of coming together and growing as a community. We thank the Ramaytu Shaloni community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. And I'd like to invite Sandrain Van Schaik, our Vice Chair for Education, to introduce our session for today and our speakers.
Hi, everybody. Welcome back after the summer break. I hope everybody had a good summer. I'm really excited about this first grand rounds of the year, which is going to be presented by a whole team. And they send us, as we request, their bios. And then I was looking at them, and it's really all very impressive people. But then I thought if I read all 3 pages, then we take away a lot of their grand round session. And Professor Ander Quo, who is leading this team, told me, please, no, don't do that. So I'm going to briefly introduce Professor Quo, and then she will introduce the team. Professor Quo and I go back a long, long time, is an esteemed colleague and a great friend, the director of, I always forget your full title here, Equity and Community, Health Equity and Community Engagement in our department, and incredibly committed to health equity and to education. She was the founding director of our PLUS program, which is still one of the only programs in its kind in the United States, focusing residency training on advocacy and leadership, and has done a ton of research on health equity, founded all kinds of programs and initiatives. And I'm going to let her speak herself about the work that she's presenting today and introduce her team. Professor Quo.
Thanks, Sandrine. I get nervous when I hear Professor Quo, but okay. So thanks so much for this opportunity. We're really excited to share about our work, and I'm going to quickly introduce our team. So Anda, I'm at CSFG in the Children's Health Center as a general pediatrician, and I co-direct the Center for Child and Community Health with Dr. Dana Long. We also have Satari Mizadi Tarani, who's one of our program coordinators. And Satari also was one of our former patient advisors with our ACEs Aware program that you'll hear about, and it's fantastic. We have Jose Cruz here with us, who's our ACEs Aware young adult patient advisor who's representing us. Jose is also a program manager at Edgewood Center for Children and Families Intensive Outpatient Programs. Precious Ogbana will be joining us shortly. She's our true program coordinator and collaborator at the YMCA. She is the director of teen programs at the Buchanan YMCA of Greater San Francisco. And then we had Daniel Vasquez. He's with us on Zoom. He unfortunately caught COVID, which is running around, so be careful. But he's a family partner case manager at BCH Oakland in early childhood development, and also is one of our incredible Family Accountability Board family leads. Lastly, but definitely not least, we have Hope Williams-Burt, who's the other family lead who's here today. She's a full-time family and community partnership consultant. And I just want to mention 2 things. One, I know there's a lot of other colleagues and centers here who are working incredibly hard and closely with community partnerships. And I just want to acknowledge all their work and how much we've learned from so many people. And second, this is just part of our team, and there's some of our team members on the Zoom, and very grateful for everyone's time that they took to be here to share with us today. Okay, so we're going to discuss the importance of centering lived experience and expertise, describe learnings and initial impacts of partnering with lived experience and expertise, and articulate resources to be meaningfully engage at advisory boards. And if you take nothing else away, just remember, please, that we're a resource here. We have been consulting. We have things we'd love to share with you. And so reach out to us if you would like to reach out to any of our advisory boards or councils, or just have some ideas you want to run by us. So just some brief information about the Center for Child and Community Health. We started about 8 years ago. We're Cross Bay, and I co-direct this, as I mentioned, with Dr. Dana Long. And really, it's about bringing together the expertise we have and passion across both sides of the Bay for our shared mission, which is to be a positive force for all children to live a full, vibrant, and healthy life. And we have 3 core main areas: clinical transformation, health equity science, and systems leadership. And across all our core areas, we hold a central value of centering lived experience. And some of the programs you'll hear about today include our ACEs Aware statewide councils, our Ready, Resilient, and Rising Family Accountability Board, Transforming Research as Usual for Equity, which is our partnership with YMCA. And another example is Dr. Dana Long's Pearls Family Advisory Board, which is her work with the ACEs screening tool for pediatric patients. That is the tool that the state uses in the ACEs Aware initiative. Okay, so I want to just take a moment to ground us in why do we center lived experience and why is this important? And I think we all can generally understand that that's an important thing to do. But we don't do it enough. And if we really want to address health disparities and close the gap on inequities, we will not be able to achieve our goals if we do not partner and truly partner with the communities and individuals who are most impacted by our systems. So this is a statement that many initiatives, including ours, use as a core tenet: nothing about us without us. And it was a good reminder for me to remember that this came back from the 1500s in Poland around advocacy efforts, and then was brought up again in the 1990s in South African disability rights movements by activists who were really tired of being excluded from decisions that affected them. So it's just a reminder that the benefits of having community at the table is that you build trust and ensure that interventions and programs are needed, acceptable, and utilized by the communities and individuals who you most want to impact. And just to emphasize this point, here's a beautiful quote from a representative on our statewide council for community partners. And it's a community organization that serves Native communities. And this partner said, "You can't just show up and jump in and start talking, because Native communities, won't listen. There has to be outreach and activities. They have to interact with you. There has to be some trust. They have to feel 100% comfortable. They're not just going to sit down and talk with the first stranger that shows up." And everybody here is aware, with the Native communities, the last time any government agency, so to speak, showed up and said, "Hey, we're here to help," that didn't go well. So they're not real trusting of programs in government. They don't know that a lot of the programs are available. And then once they do, you have to get the point across to them that it's okay to reach out, that it's different now, that there are people wanting to help, because help from agencies has not been great for them in the past. Also just wanted to share this helpful framework for community engagement to ownership. And there are a variety of different frameworks describing community engagement, but I find this one particularly useful. It's from Rosa Gonzalez. And what I like about it is that it really identifies what are the activities that are reflective of the state that you're in, and how can we move towards number 5, where we're co-ownership or sharing power. So if you're at 0, which is ignore, what is that message to the community? It's that your voice, needs, and interests do not matter. What do those activities look like? Things like closed door meetings, misinformation, or systematic isolation. Then there's inform. I'm not going to go through everything in detail, but as another example, at the consult level, What is the message to the community? We care what you think. What do those activities look like? Public comment, focus groups, community forums, surveys. Then we have collaborate, and we have at the end, and what we're striving for is to defer to. And this is around community ownership. And the message to the community is it's time to unlock collective power and capacity for transformative solutions. What does that look like? Activities like community-driven planning, consensus building, participatory action research, participatory budgeting, and that's a huge one, I think, and cooperatives. Sorry. Okay. So you'll see this QR code in various places through the presentation. It leads you to our 2-page infographic or brochure that describes our different advisory councils and how to contact us. So please feel free to save that QR code for you and reach out to us. We're going to spend a little time just going through several of our programs and how we are partnering with patients and advisors in our community. And I'll turn it to Satare.
Hi, everyone. We wanted to talk a little bit more about the ACEs Aware, the UCLA UCSF ACEs Aware Family Resilience Network, otherwise known as UCAN, and how we center lived expertise in that project. It has been a real honor to work with different statewide community advisory groups at UCAN through CCCH. I started as a patient advisor myself. And UCAN basically implements the ACEs Aware initiative on behalf of the California Department of Healthcare Services and the Office of the California Surgeon General. And ACEs Aware is the first in the nation effort to promote early detection and intervention to mitigate the health and societal impacts of adverse childhood experiences, or ACEs, and toxic stress. And ACEs Aware mission is to educate, train, and support the California healthcare workforce to be able to identify, respond, and treat the impacts of ACEs and toxic stress across the lifespan. So at ACEs Aware, we have 4 different statewide community advisory groups. We have the young adult patient advisors/leaders, and that's a group of 6 patient consultants aged 23 to 26 with extensive leadership experience. They are available up to 20 hours per month, and Jose is one of them. We also have the Youth and Young Adult Council, which is a group of 15 individuals aged 16 to 26, and they attend 1.5-hour meeting per month. We have adult patient advisors who are a group of 9 patient consultants ages 36 to 65 plus, and they're available up to 20 hours per month. And lastly, we have community partners, which is a group of 21 CBOs. They represent CBOs who work closely with the Medi-Cal population, and they attend 1.5-hour meeting per month. We won't be able to go into depth about each of our councils, but I just wanted to share a few pictures of the community partners group when we've had the opportunity to meet them in person at different conferences. Again, all of our councils are statewide and they meet virtually, but specifically the community partners, they represent CBOs that serve populations that are affected by ACEs or predominantly have Medi-Cal. We wanted to highlight some of the impacts of the community partners group. For example, for the past several months, they've been working with us to adapt a toolkit that was intended for providers for use for CBOs with their clients and community members. You'll see actually a picture of the stress busters on the right-hand upper corner. And basically, stress busters are 7 evidence-based ways that you can use to mitigate toxic stress. If you go to acesaware.org/manage stress, we actually have a 5-hour training on the stress busters that offers 5 continuing medical education credit. We also have patient-facing handouts on each of the stress busters that are also available in Spanish that you can print and make available to your patients. The community partners also have provided feedback that led to a revised version of the CDC's ACE pyramid, and you see a picture on the lower hand side. Community partners have also advised the design of the statewide ACEs awareness campaign that we'll go more in depth about in the upcoming slides. They have provided feedback that has led to a revision on the ACEs Aware Burnout Curriculum course, and that's also a course that you can visit on our website, on the ACEs Aware website, and that offers continuing medical education credit as well. And lastly, they have provided feedback on the ACEs Aware data visualization webpage. So that's basically a webpage on the acesaware.org website that has ACEs data by county across California. Again, one of the groups that we work with is the Youth and Young Adult Council and the Young Adult Patient Advisors. What is very interesting about our council is that we have 6 young adult patient advisors, such as Jose, who actually facilitate and co-design the council meetings. And that is very unique because that means the council meetings are created by youth for youth. And also, all of our council members and advisors are well versed on ACEs, and they have experience with Medi-Cal. If you see, look at the picture, you see that this is a group of very diverse individuals, not only in terms of race and ethnicity, but also in terms of sexual orientation and gender identities, and also the geographical location that they represent across California. Some examples of the impacts of the Youth and Young Adult Council and the Young Adult Patient Advisory Group is that for the past almost a year now, they've been advising the statewide ACEs awareness campaign. It's called Live Beyond. Jose will talk more about that campaign, but basically our advisors advise the campaign from the very beginning stages of development in terms of the name of the campaign, like the colors that are used, the tagline, the messaging, the healing activities, and they've been also able to submit content for the campaign as well. And the campaign was launched in May of this year, and during the first quarter, so from May to June, it has had over 326 million impressions, and that essentially means the number of times someone saw the campaign. This number includes duplicative times, so that's around like 325 million paid media and around 7,600 organic social media impressions. This group has also made state resources on ACEs, the patient-facing Stress Busters handouts that I mentioned earlier. The group reviewed those to ensure that they were culturally appropriate, youth-friendly, and appropriate for the population to use. And that's something that's available on our website. And they have co-designed multiple ACEs Aware webinars. One of them was specifically focused on formerly incarcerated youth. Another one was focused on the Live Beyond campaign, and it was done with Dr. Diana Ramos, the current Surgeon General of California, and Dr. Nadine Burke-Harris, the former Surgeon General and the first Surgeon General of California. And we actually have an upcoming webinar coming up that Dr. Ko, Jose, and I, and another youth advisor are going to be part of. That's happening on Thursday, September 26th, 12 to 1. You can scan the QR code to register for that webinar. And if you attend, you will get 1 CME credit. And lastly, I've had the great honor of publishing an op-ed with Dr. Ramos, the current Surgeon General of California, on the Live Beyond campaign and how our personal lived experiences with ACEs has affected the work that we do, and our hope for Californians to start having conversations about ACEs and know that there's healing ahead. And I'll pass it now to Jose to talk more about the Live Beyond campaign.
Hi, folks. My name is Jose. I'm a young adult patient advisor for the UCAN ACEs Aware initiative. So I'm just going to share a bit about our campaign impact and what the youth we've been involved with have been working on. But how Satara mentioned earlier, we definitely have been working on a lot of the ACEs Aware resources and handouts, as well as the material that we publish on the website on ACEs Aware. We also work with community partners to provide youth feedback on their own sort of materials and campaign content. But too far. All right, I guess I just want to showcase one of the content creations that we've sort of like created alongside one of our community partners, this one being the Office of the Surgeon General. And so we actually flew down some of our youth leaders down to SoCal to help them produce and direct a campaign video. So this one is centered around ACEs Aware and the Toxic Stress campaign. So let's check it out for a bit.
Those are those messed up things that happened to you in childhood that probably shouldn't have happened, and you had no control over them whatsoever. And if not cared for properly, they can turn into long-term health impacts. They can even impact your life expectancy.
I knew that I had experienced trauma as a child and adolescent growing up, but I didn't realize how high my ACE score would be.
It led me to eventually end up being incarcerated at the age of 19. You know, I was facing 23 years to life in prison. And I just correlate all of that to, like, you know, the traumas that I was enduring growing up.
So having that scale by the Surgeon General of positive stress, tolerable stress, and toxic stress provides us a reference and a framework of what can and cannot be acceptable for people and their health.
Drinking teas, eating healthy, having a morning and night routine, just kind of soothing my nervous system.
Yeah, for me, the biggest coping mechanism that I utilize is movement. And right now in my life, that's boxing.
Some of the things I do to help me manage my stress. So I like to paint and I like to knit sweaters and different outfits.
I'll spend hours just kind of tuning out, just sketching different types of things. It definitely helps, you know, ground me.
I've been very blessed to find people who are on a similar healing journey. So we have similar vocabulary and similar experiences that we can relate about and we can share. I was able to learn through them how powerful.
The person who had impact in my life is Crystal Guerra. She was my therapist inside of Orange County Juvenile Hall. She played a pivotal role in me being able to self-actualize, realize that I wasn't my worst mistakes.
You're more than the worst thing you've done, and you're far more than the worst thing that's happened to you. You know, just because of the environment that we came up in doesn't mean that we're always going to be subject to something that's unhealthy, unpleasant, traumatic. At the point now where I am living beyond, you know, what I went through, and I'm working with people every day, young people, like helping them get their second chance, helping them live beyond some of those similar experiences that we had that might have been so traumatic.
Right, quite a powerful video, if I dare say so myself. We actually had a lot of positive feedback from our young adult council, in which they said that they definitely saw this sort of content creation as a way to help them express their own lived experiences and help relate to others how their own healing journey went. And I just want to also point out that a lot of our young adult council members were also quite, I want to say, receptive to seeing their fellow members and patient advisors be involved in this sort of content creation, help them feel some ownership over the campaign overall. But on to what I want to sort of talk about a bit more is to, folks, please check out our Live Beyond campaign website. So up on that website, you'll find a lot of resources, including personal journeys, stories of recovery, more content on how folks can use stress busters, as well as how to manage toxic stress. And I want to point out that all of this website, all the content on the website was definitely youth driven. And a lot of our own young adult council members were heavily involved in uploading a lot of the written, audio, and video content that you'll see up there. So again, on the site, you'll see a lot of stories, you'll see a lot of lived experiences. And what I just want to point out is a lot of our youth leaders were very heavily, I want to say, not just involved, but they were very passionate about this subject, helping others sort of try to find the same healing that they have found in their own personal journeys. The experience was definitely empowering for a lot of our young adult council leaders. And I just want to say that as you folks explore this website, you can sort of just take one thing away from it, is that it's a lot of content for youth. So if you work with a lot of youth patients or youth members in the community who have gone through ACEs or have questions around ACEs, I would heavily recommend showing them this website. And it's just youth focused, youth centered, and definitely youth co-created. So I'll leave you folks with that, alongside with another recommendation of please check out this website.
Okay. So that was one example of our programs. That's a statewide program with statewide councils. And we're going to switch gears a little bit to a more locally based, but larger impact than local Family Accountability Board with our Ready, Resilient, and Rising project. Just to give some background so you understand what Ready, Resilient, and Rising is, this is one of the Center for Child and Community Health projects, and it includes, I guess it's really rooted and first and foremost in our clinical practices and what we envision working with patients and families and communities to provide optimal services. And so our vision is to transform early childhood serving systems so that every young child and family has access to a healing-centered system of care. What does that look like? So we had funding to pilot to have two clinical hubs. One is at Claremont Clinic in Benioff Children's Hospital, Oakland, and the other one is at the Children's Health Center at CSFG. And our initial clinical pilots was around integrated behavioral health and dyadic care. So we had the example at Claremont Clinic is the Resilience Clinic, and also now Bloom. The Resilience Clinic led by Dr. Joanne Jung, and my colleague Kate Margolis at the Children's Health Center, and her dyadic model as Healthy Steps. The focus is on young children, and in addition to developing the clinical program pilots, we also know that those alone won't lead to the vision that we have. And so part of Ready, Resilient, Rising is also around culture change and capacity building. So Diane Hellberg and Barbara Ivins, along with our FAB, are co-developing and co-creating a resident training curriculum on early relational health, and really trying to change, you'll hear more about it, but the culture and the dynamic between providers and patients and their caregivers. And then the other aspect to support the pilots that are happening in the clinics is around sustainability and scale. And that is called the Toxic Stress Network Improvement Collaborative, or TONIC. And this has been in existence since about 2018, where we have managed care health plans, we have DPH governmental agencies, our community partners such as Safe and Sound, which is one of our core partners, to reimagine San Francisco systems of care for children and their caregivers, so that it's grounded in lived experience and expertise and aligned across public health, social services, community groups, schools, health, and philanthropy. So our goals that we're working on right now are twofold. One, spreading and scaling the dyadic model, and creating a collaborative multi-sector network to support billing and quality efficiencies for the successful dissemination and implementation of the model. So that's a mouthful, but what it really looks like is we had this pilot. Kate Margolis and her team and their brilliance asked San Francisco Health Plan, would they be willing to have a pilot to show whether this is generates dollars or supports the program through billing, or will they be in the red? And so the pilot showed that it actually could be revenue generating. Then they took that to the state and pitched it to the state, and it became the dyadic benefit that we now have in California. And Kate Margolis has this beautiful new TA center to support dyadic dissemination across the state. And I think she gave grand rounds on that earlier this year. The second goal is around identifying opportunities for braided funding and partnership to enhance services and supports for young kids and their caregivers who are impacted or involved with the child welfare system. And again, all of this, I think, to me is like, we have to figure out what happens locally in the county in order to figure out how we can disseminate that model more broadly, because every county is different. But until we get into the weeds in the county, we can't really figure it out. And so Central to all of this is our Family Accountability Board that Tonic and the curriculum and the clinics, that everything we do is accountable to our FAB. And I'm going to bring Hope up here to share more about it.
Hi, it's always a joy to come. My last child out of 4 was born here at Mission Bay. And I was sharing with Anda that it was in that moment of her birth that I realized that transformational change really is that partnership. It really is that understanding that we are greater together. And so I have the joy of taking part of co-facilitating the San Francisco FAB. We have 2 family accountability boards with 14 members. We call them FAB because they are fabulous. It stands for Family Accountability. So you can still be fabulous while you hold us accountable. Our members come from across San Francisco, Alameda County, and Contra Costa. They are caregivers of young children. They've gone through the system, so they definitely have the voices, the experience with Medi-Cal, racial and ethnic diversity, the knowledge of the child welfare system and how we can bring that lived experience into the space to be able to really tell the voice. We meet monthly, virtually. We've just moved into now meeting in person. And what you'll get a theme of throughout this presentation is that we are driven by the people that we work with. We aren't establishing the table and saying, okay, this is what you're going to eat at the table. We're really in our work saying, we want to build the table with you. So if our family accountability board says, hey, this is not working with meeting in person, then we adjust what we're doing so that we're able to build that capacity and that ownership with them the way that they're desiring. The FAB impact. So in San Francisco, the FAB focused on the tonic and dyadic care model and giving recommendations. They also provided recommendations to Tonic on the child welfare system. Now, this was a real in-depth process in that we just didn't do what the norm. And the norm is usually that we go to the community, we ask them, you know, what was your life experience? What happened? And we abstract from them. But this process that we took was a process that we incorporated not just how we're taking their voice and taking from them, but we really integrated this like in-depth, like tell us what, you know, what is it that we need to do differently? We incorporated their quotes in the report, in the recommendations. So when we're talking and we're presenting to the providers, it's not just we're saying, oh, as a collective, but you really can get that human effect of when you hear the community in there. And then in turn, we went to the system and said to the system, how are you then going to hold yourself accountable? What are you going to give back to the community? What information? So it has really been an in-depth process in taking what the families have said. And I love this quote. I was just so terrified that I was losing my children. I continued to hide the fact that I needed a lot of help. It ultimately led to my children getting removed. And at that point, I did get the help. Our family accountability board in this process they pushed us to say, how do we push into making sure we're preventative? How are we making sure that we take action when we need you before we're in the system? And so we've really spent time incorporating the FAB's recommendations on the dyadic care and the San Francisco Health Plan. They meet with the provider. They sat and said, this is how we would like to see the pamphlet. This is really an in-depth process of really building the capacity of the community to be the owners. We can't ask them to be present with us if we're not going to build the capacity for them to understand and for them to really walk with us. We also incorporating the recommendations into the policy paper on the state of child welfare in the SF County, including making personal narratives more central in a section called Families Beyond the Numbers. hold that theme about having our families beyond the numbers. When you're talking about culture and you're really talking about transformational change, that really is talking about a culture shift. It is talking about not just building a relationship or talking at, but really being with. And so this process, our FAB created this cultural context of what they see developing as what should be the social norm. That if we practice this and it's embedded in our work on a regular basis, this will become the norm for how we deliver and how we build and how we move to ownership. So one is sharing information. As a parent, I always hear, I get the perspective of the parent, what should I share? But our parents are really saying that when we're talking about power and we're talking about power sharing, it shouldn't be that anyone should decide what information or how the information. There should be a process that we're involved in, whatever that might be. I love one of our FABs, she shared this quote, just because I share my child doesn't mean I share myself. And so this part of being our authentic self, but consciously being professional. Sometimes we look at like building a relationship and wanting to build a relationship, we have to alter who we are. Our families are, when they were making their recommendations, they were saying, I want you to be you. I want to build a relation with who you are, but I also want to have you as my partner and know that you'll bring your expertise in the room, that we both can share that together. We are better together. Building partnership and trust, humanizing the clinical experience and having empathy. Again, partnership. And so we're in the middle of piloting. We've piloted 3 residential focus groups with our family advisory boards. They created their videos as a tool of and exampling these recommendations that they made of like doing with me and not to me, understanding the family's journey, how to use open-ended questions, developing and incorporating partnership in the decisions. So over the course, they built their script, they decided what we gave samples of co-sleeping, what that would look like, because that's a very controversial topic, but being able to model what that looks like from the parent's perspective. And then we went into talking to the residents and saying, okay, well, how do you find this to be useful? We're looking at transformation and change is not just one direction. We need to address it from the system level, and we also need to address it from the ground level. And that's the approach that we're taking with our Family Accountability Board, is that we understand that they're in a system, and system change takes time. But we don't want to give up on the process, and we don't want to lose the trust and the relationship as the system, and we're trying to flip it upside down and really bring ownership to the system. But at the same time, how do we address what our parents are seeing? And I will turn it back over to Anda.
Okay, this is like a buffet of programs, so sorry that we're transitioning again. But we all, again, just wanted to show a variety of examples of how we're really centering lived experience in the various programs we have. So this is, I think, the last one we're going to mention. It's Transforming Research as Usual for Equity or TRUE. And just for some background, this is a partnership with the YMCA, but we really started in, I think, 2018 with the PCORI Engagement Award that we had with Coleman Advocates for Youth and Support for Families of Children with Disabilities, with a parent-focused advisory board where they created their priority research list. And then we, in 2022, got another engagement award and focused on youth and youth engagement, and partnered with the YMCA. Meg Yakimore is my co-PI and a great partner. So you'll hear more from Precious about this, but just in brief, the goal really is to create sustainable infrastructure for us and our research to be able to partner readily and easily with trained young adults and youth who are trained in how to advise on research and how to serve on an advisory board. So we co-developed in an iterative way over several years a curriculum with 7 modules that the youth and young adult leaders created with us. We're in the process of revamping that and creating a full curricular toolkit from that. And they are now ready to go. We've trained 2 cohorts that we're meeting monthly. They've been taking consultations. I just wanted to give a shout out to some of our researchers who have been utilizing them and consulting with them and embedding them in their proposals and research grants in their budgets. So Emily Perito and her partner Advance project, whoops, I'm sorry. And Jason Nagata, who also has been consulting with them. Just grateful for your partnership as we got our wheels greased, and also Naomi Bardak. Okay, I'm going to turn over to you, Precious.
All right, good afternoon, everyone. My name is Precious Lugbana, and I'm the Associate Director of Teen Programs at the Buchanan YMCA of Greater San Francisco, located in the Western Addition Fillmore, Japantown area of San Francisco. And I'm just going to talk a little bit about the structure of our program for the TRUE project. So we started off, Dr. Ko mentioned, with 3 research leads who supported in co-creating and co-designing and facilitating the curriculum for our young people. And our structure throughout the project was to have biweekly meetings twice a month. Now we meet once a month as we consult different research projects, but we had biweekly meetings where we provided dinner for our youth. We spent a lot of time community building and spending time building our team building and doing team builders with each other. And we were anticipating, and in reflection, we learned that was the most critical piece in getting our young people to feel comfortable and safe in our space, because they had to be vulnerable to share their lived experiences. And you can't do that with a whole bunch of strangers, right? And then, of course, also having people in their opinion, people of status who have these degrees that they're also chasing and want to have essentially sometime in their own lifetime, right? There's a power dynamic. And so it's not about just hearing them feeding us the answers we want to hear, but it's also just giving your genuine, authentic lived experience. And to a little bit about our curriculum, during our time together at our workshops, these are the modules or the themes for our modules that we examined. And our youth, we have a good handful of youth who are super excited to start engaging in their civic duties, right? They're around that age between 14 and 18. And so the themes or the workshops that they particularly loved more were the health equity, social determinants of health, advocacy, and then ethics and research in racism and health. And then here's a little bit about our youth identified priority list. So what we had them do on their fall break, winter break, and spring break, depending on when the cohorts happened, they would survey their peer communities. So if that's clubs, their friends who they're sitting with in the cafeteria, cousins or family members around their age, sports teams, any sort of extracurricular activity, and they're asking their peers, what's important to you as it relates to your health as a teenager or a young adult? And these were the themes that emerged as they created their priority research list. Generational trauma, specifically as it relates to reproductive health. So we've identified that there's a group of young people generationally having children younger and younger. And that's probably because we're dancing around having that conversation of reproductive health because we see our youth as too young. That's too tender of an age to bring up reproductive health. And then, of course, falling into that same cycle of generational trauma of having children at a young age. Mental health and talking about specifically mental and emotional stress or distress that youth are experiencing, and what are remedies other than medication that can treat those. Substance abuse, we had a great debate about this because there are some people who are on medication and those are prescribed by their physicians and their doctors to support with care, right? But then we also talked about where the initiation and the maintenance of unprescribed substance use is coming from, and what are the influences that are starting that and continuing that use. And then haters are all the isms. So our youth experiencing colorism, heterosexism, ageism, sexism in general, and all the others. And then societal standards, what's stressing our teens out, whether that's the need to be academically successful, what pressures are happening in the home, the need to belong or to fit in, and how that plays a role in what's stressing them out. Violence, particularly physical violence, because we talked about mental and emotional violence during our mental health or under our mental health topic. And then specifically violence emerging within schools, and then violence emerging among the LGBTQ plus or queer identifying youth. And then physical health issues. Those are the, I guess we would identify as the traditional health issues of like obesity, or if I have like a broken limb, or reproductive health issues, things of that sort. And our youth worked really hard to come up with these, and then they presented them, and it was super exciting. But the main point, like into a lot of people's point of creating that space for them to feel comfortable and being very mindful of like that extraction culture. We're not dangling a carrot in front of them of like, oh, this is a stipended opportunity or this, that, the other, but making sure that they can receive from us as much as we're receiving from them. And I think where that's really emerged is the pathways programs, or finding pathways for our young people into healthcare professions or careers. And I'm going to pass it on to Dr. Kuo, who's going to talk a little bit about our promising practices and what we've learned as a result of our project. Thanks.
Okay, we timed this because we really wanted to make sure there's time for questions. So I'm not going to spend a ton of time on the lessons learned, because that was a whole presentation we've given, and it's recorded in case anyone wants to see that. It was recorded with CTSI, and it was at the Health Disparity Symposium. But since 2023, we've been part of 38 different engagements, like presentations and webinars and tabling and posters, trying to get the word out about our different councils and the lessons we've learned. And there's a lot we've learned. There's also from others, and also we've culled down our lessons from our experience and also from the literature. And I just want to thank Kathleen Tebb with working with me and a medical student on doing sort of like a scoping review of the literature. There's not a lot out there, especially when you're looking at youth engagement on research councils and their impact. So we have the 5 themes that we have from our lessons learned include taking the time to lay the groundwork. That really means like this, to set this up well, I feel like you can't just rush through and slap one together, which is part of why one of my goals is to really find ways to create infrastructure at our institution to support a sustainable advisory board of youth. And luckily, we're partnered with CTSI, and you can consult through their portal. We're also working to have it integrated into the CTSI renewal. So anyway, the point being, laying the groundwork thoughtfully is really important. There's a whole section on that. Recruit members with intention. This was really interesting because we may think we're recruiting with intention, but there are a lot of things we learned, like it's really not about social media posting, and things we learned were that it's really word of mouth and having someone trusted suggest a youth to apply. So going out to those community organizations that are trusted partners in the community, like the YMCA, and having them say, hey, Johnny or whomever, I think you should look at this. And that gets people that are harder to reach. If you want to get the classic people that you might get from just posting it somewhere, or someone who's like feels comfortable enough to take a flyer and apply. But if you want to reach other populations that you may not normally reach, we learned different ways to do that are more effective. Compensation is a huge issue that we really underestimate. And again, it gets to what kind of advisory boards do we want? What are they constituted of? Are they people that can just volunteer their time? So we make sure we build into our budgets, and we have sample budgets, and we are happy. We've been consulting with people on what that looks like. We're happy to talk more about what compensation really looks like and what barrier reduction and removal really looks like. We've learned a lot about that. It's not just translation, as an example, but again, we're happy to talk to people more about that. And then supporting meaningful participation. And just tip I have that I will always now do is to partner with people that are closer to the council members, that in whatever way, however we want to describe that, but it's usually not me. So I've really appreciated the partnerships with the YMCA and with our young adult leaders in every single, and our family leads in every single council that we've had. That has been critical. So this is where we talked more about these lessons we've learned, and their QR code leads you to the recording. I believe that we did. Okay, so I said at the beginning, if you take away nothing else, remember that we're here to partner, and please reach out. We all our different advisory councils can, and our true council of young adults and teenagers. I think about it across the spectrum. Sometimes people reach out, it's just about recruitment, but then we're missing an opportunity, really. It's how we're interpreting this data. Does that make sense to you? What are our findings making sense to you? Does the study design make sense? Does the survey language make sense? How can we make it better? Strategizing on recruitment, problem solving through study implementation, building engagement into your budgets, as I've mentioned. We have the curriculum that we could share now as the 7 modules, but we're developing a toolkit around it. And we've also been able to just send other opportunities that you all might have. Like if you are recruiting for another council or you have an opportunity, we have been disseminating it to our groups that way as well. So I'll end with a quote from Emily Perito, who shared, because she can't be here today, that consulting with the YRAC provided great insight for our research team. We got great advice on how to engage adolescents and what to avoid in our attempts to engage them. The facilitators were phenomenal at helping direct and engage the group, and we got our questions answered and learned what other questions we should be asking. Thank you, Emily, for trusting us and working with us. And I'm having trouble. There we go. Okay, that's our infographic one more time. And please contact us if you want a consultation. And if there's any questions that we really hoped, we're not going to be able to get this panel here again, probably. So this is an opportunity to ask questions to other people besides me, I think. Yeah.
Yeah, I had my hand up before. You had a slide about your goals. You did. And what I noticed, there was nothing quantitative. I mean, you said like engaged groups or children or whatever. But it seems to me for the goal to have any meat on it, you ought to have a target number, like either absolute number of children or percentage of children.
So I'm
just wondering what you have to say about that.
Yeah, the question is that I had a slide that had goals on it, and it was sort of general, but it didn't have a quantitative number on it. And I'm trying to remember what slide that is, but I will go back.
You might have to talk about why we're
Come on up, Hope, because it's there's Zoom.
Again, I can kind of speak to why we're shifting from just using numbers. That's why I said really hold the people behind the numbers, is because we're really seeing that numbers don't really tell a story. It's really about the qualitative work. It's about what are the stories being shared? What is the data? So we're really in this work is not just looking at how we typically and have in the system, because we miss things in between, but what are the stories telling us? So it might be where it's 5, but what is the story? What is the richness? What is it that the themes that we can take away? So that's why you see more, it seems general, but it really is in depth. And we've incorporated a lot of the quotes, even in this presentation, to really tell the story.
I'm not sure if, so the goals, I'm not sure actually which goal one it was, but I think we've shared some vision and mission. And I would say, like, if you take our Ready, Resilient, and Rising program, and I'm trying to speak up, sorry, I hope you can hear. Kate Margolis's program that's kind of embedded and off on its own, Healthy Steps, certainly has number of goals, and our goals are around creating sustainability and scale through a multi-sector table and developing a curriculum. And if we have to apply for a grant, we'll have a number of trainees we'll have in there. So But I appreciate the observation that we could be more specific about numbers. One example, building off of what Hope said, is we have this paper that really described what child welfare looks like for 0 to 5 in San Francisco County. We got really down into the numbers, which was hard to get actually. And I'm really grateful to our county partners who pulled numbers. And we have a table in there that shows, because a lot of county partners said, oh, why would you be looking at how to improve care coordination for kids in child welfare? They get a lot of services already. But when you actually divide it out, kids who are in family maintenance are the gap. I mean, there's a lot of gaps, but they had a particular gap because they actually don't get as many care coordination services than the court mandated placement, out of home placement sector. So it was great to get the data there. And we have that data, and we had it all laid out in this paper. And when we're co-writing it with the FAB, they said, this is really important information, thank you. We don't see ourselves reflected in this. And so we went down this whole route of halting the publication and doing interviews. And so there's a section now called The Families Behind the Numbers that they co-wrote through interviews with the writer. Things like, so building off of what you said, Hope. Sandrine?
Thank you. And I appreciate that comment, although I can't remember the exact quote, but there's some quote that says, one tragic story about one person with a terrible outcome tends to actually generate a lot more interest than a number of a million of good outcomes. And the quote is more beautiful than I do, but I think stories are pretty powerful. I want to start by thanking you for this great presentation and a very comprehensive overview of series of programs. I'm also impressed with the work that's being done. I do have a question a little bit about outcomes in a sense, because it sounds to me that some of these advisory boards, like a quote like Emily Burritos is a very clear, like, here's an impact of what you've done, right?
Mm-hmm.
But some of these advisory boards, and I was mostly struck by the youth advisory board and their priorities.
Uh-huh.
It reminded me a little bit of what we tend to do a lot here at UCSF, and that's doing town halls. And the biggest complaint that people always have about town halls and about surveys is like, yes, you ask for all of our input and then nothing happens. Right? And I can totally see that with that priority list of research, because of our funding priorities and where it all comes from and who makes the decisions, we might actually not necessarily, that might not necessarily influence a whole lot of what we do at UCSF or in California in general. And that might then become like deflating to a council like that. Why are we suggesting this if they're not doing any thoughts around
yes, and
the process?
I probably can't repeat everything for everyone on Zoom, but but I'll take the last part of it, which is the youth, the true priority research list that came out of our PCORI Engagement Award, where that's something we have to do is generate their priority list. And I'm going to ask Precious and anyone else to chime in here, and Dante's here too in the audience, but it's on us partly to disseminate that. We have to get that research priority list out. Part of what I envision is you all apply for grants. In those grants, they're like, oh, did this come from the community or did you just make this up in your Ivy Tower? And so part of me is like, this is an opportunity for us to use this list and say, hey, this came from our local youth. And if that's all that does, that's great. That's one way. And then the other way is what Emily Perito and Jason Nagata have done, and is to engage with the youth on a more regular basis. They have is this curriculum we have for our council making sense? And can you revise the slides with us? And what does this survey make sense? So the priority list, I think it's on us to utilize it. And I don't know if you want to add anything, or Sandrine, I may not be answering exactly your question. Precious? Only if you have anything to add.
I was going to similarly chime in, like with what Dr. Quo said, in that, like, I would ask you all, like, what as physicians or those who are working in the healthcare system, what are you all going to do with the research list? It exists, and like to Dr. Quo's point, we can disseminate it, and like the power is in the voice and it's in the people. And also the power is in the partnership, as Hope mentioned. And so as partners in healthcare, my question is as equally as well, like, what do you all plan to do with the knowledge? Because knowledge is power. And now that you know that our young people this is what they're concerned about as it relates to their health, what are you all now going to prioritize when you all apply for those grants?
And that list, those are the themes. We have, I think there's like, I don't know, 48 questions that are more nuanced. So we're happy to share that as well. And I'll close now, but my goal is for sustainable infrastructure. I'm hoping that, and more funders and grant opportunities are requiring advisory boards and community and patient input. And it's very hard to slap one together in a genuine way. And so I hope that this will be a resource to all of us to utilize and not only help you all get funding and stuff, but make our research and our programs and our clinical programs better and more reflective of what our communities and patients want to see. Thank you for this opportunity.